Let's look at some examples of clinically available potential geroprotectors. Vitamin K is a fat-soluble vitamin, essential for the biosynthesis of proteins in cells, ensuring adequate blood clotting, retaining calcium in bones, and preventing vascular calcification. In the last two cases, it performs its function in conjunction with vitamin D, which is responsible for the absorption of calcium from food. Mechanistic study shows that vitamin K activates matrix GLA proteins that inhibit bone morphogenetic protein-mediated cartilage calcification. Matrix GLA protein, MGP, gamma carboxylation by K2 can help with inhibiting vascular calcification. Evidence from clinical trials about the protective role of K2 in osteoarthritis is limited. K2 supplementation in a dose of 90 micrograms/day had a significant effect on reducing bone loss in postmenopausal women, but in combination with calcium and vitamin D3 brought no additional effects. Vitamin K2 can reduce the osteoprotogerin induced by glucocorticoids that may play a role in the prevention and treatment of osteoporosis. Long-term use of MK7 supplements improves arterial stiffness in healthy postmenopausal women, especially in women with a high arterial stiffness. Vitamin K2 supplementation for 4 weeks increased insulin sensitivity in healthy young men. In the human body, vitamin D is synthesized in the skin, when exposed to the sun for at least 15 minutes a day, or comes from food. Vitamin D is found in fatty fish, herring, salmon, mackerel, caviar, cheese, sour cream, and butter. To develop your own vitamin D, it is sufficient to stay in the open sun for 15 minutes every day. Studies carried out on the nematode model revealed an increase in life expectancy under the influence of D3 by 39%. Experimental, epidemiological, and clinical studies have made it possible to establish that an insufficient level of the active form of the vitamin in human blood correlates with mortality from all causes, including cardiovascular, oncological, and infectious diseases. A meta-analysis of 50 randomized clinical trials of 148 patients showed that supplementation with the D3 form of the vitamin reduces mortality in older women. Vitamin D at a dosage of 400 to 833 IU per day reduces cancer mortality. Vitamin D supplementation significantly reduced total cancer mortality but did not reduce total cancer incidence. In other studies, vitamin D supplementation reduced the risk of cancer death by 16%. An inverse relationship was found between the level of the active form of vitamin D and blood plasma in some types of cancer, including colorectal cancer and breast cancer. Several randomized clinical trials have been conducted to investigate the effect of oral vitamin D supplementation in older patients to prevent or treat sarcopenia, but the results are still controversial. The systematic review suggests that the combination of vitamin D and calcium can exert a beneficial effect on osteoporotic fracture reduction. Its deficiency is associated with obesity as well as severe COVID-19. Vitamin D in high doses is toxic. In addition, studies in mice have shown that vitamin D hypervitaminosis is associated with accelerated aging. While in small doses this vitamin reduces mortality from cardiovascular diseases, in high doses the mortality rate increases. Curcumin is one of the most studied and popular natural geroprotectors. It is found in turmeric root and curry. In experiments on nematodes and fruit flies, curcumin caused an increase in life expectancy, from 20% to 45%. The mechanism of its action on aging is multifaceted. It is able to suppress inflammation, is an antioxidant, has anti-diabetic properties, slows down the progression of Alzheimer's disease, and lowers the level of lipids and cholesterol in the blood. It possesses neuroprotective, antidepressant and anti-cancer properties. It has a protective effect for the liver and kidneys, antibacterial and antifungal effects, suppresses putrefactive processes and irritation of the intestinal walls. When consumed up to 8 grams per day for several months, side effects and toxicity were not observed. The disadvantage of curcumin is its rapid excretion from the body, however, its bioavailability can be increased by an order of magnitude when consumed in conjunction with black pepper. Curcumin is an epigenetic modulator. It also affects pathways to induce tumor suppression and apoptosis. Meriva, a curcumin phosphatidylcholine complex, is clinically effective in the management and treatment of osteoarthritis. Treatment of a non-alcoholic fatty liver disease with curcumin suggested improvement of different features of NAFLD after a short-term supplementation. A 9-month curcumin intervention in a pre-diabetic population significantly lowered the number of pre-diabetic individuals who eventually developed type 2 diabetes. In addition, the curcumin treatment appeared to improve the overall function of beta cells. The bioavailable form of curcumin is well tolerated and can positively influence weight management in overweight people. N-acetylglucosamine affects health through enzymatic N-glycosylation of proteins. It has antimicrobial effects as well as antioxidant and anti-inflammatory activity. It acts as an immunostimulant and reduces the development of tumor processes. N-acetylglucosamine increases lifespan in nematode and mouse experiments. Consumption of N-acetylglucosamine and chondroitin sulfate for 12 weeks or longer has a positive effect on the self-esteem of knee function and physical activity at home in middle-aged and older Japanese adults with knee pain and/or stiffness. D-glucosamine is a well-established inhibitor of both hexokinase and glucokinase, which play a key role in the first step of glycolysis. It inhibits the development of tumors and inflammation, and activates autophagy. Elderly people taking glucosamine saw an 18% reduction in overall mortality. Despite the fact that it is prescribed for joint problems including osteoarthritis, arthritis, and loss of cartilage, it is also effective for the prevention of other age-related diseases. In particular, it reduces the risk of carcinogenesis, cancer of the rectum and lungs. It suppresses the development of pneumonia in smokers and systemic inflammation. It also promotes the remyelination of neurons after damage. Glucosamine together with chondroitin and osteoarthritis has not yet confirmed its effectiveness. Specifically, glucosamine improves joint mobility and chondroitin reduces pain. At the same time, an analysis of mortality in the NONS cohort in the United States revealed an interesting side effect of glucosamine with chondroitin, a decrease in overall and cardiovascular mortality. In a population-based prospective cohort study of 495,077 women and men from UK Biobank, regular glucosamine intake was associated with lower mortality from all causes, including cancer, cardiovascular disease, respiratory and digestive diseases. Pyrroloquinoline quinone improves energy utilization and reproductive performance when added to diets devoid of PQQ, including mitochondriogenesis and beta oxidation. PQQ does not appear to elicit any ergogenic effects regarding the aerobic performance or body composition but appears to impact mitochondrial biogenesis by way of significant elevations in PGC1 alpha protein content, PID, 31,860,387. Pyrroloquinoline quinone prevents knee osteoarthritis by inhibiting oxidative stress and chondrocyte senescence. It also prevents estrogen deficiency-induced osteoporosis by inhibiting oxidative stress and osteocyte senescence. PQQ supplementation resulted in significant decreases in the levels of plasma C-reactive protein, IL-6 and urinary methylated amines such as trimethylamine N-oxide, PID 242310099. PQQ causes increased activity in the right prefrontal cortex associated with increases in regional cerebral blood flow and oxygen metabolism, resulting in enhanced cognitive function. Alpha-ketoglutarate is an intermediate product that occurs in the process of cellular respiration in mitochondria, the structures of the cell responsible for the production of the bulk of energy in the cell. The ability of this compound to inhibit the activity of aging-related kinase mTOR and to activate autophagy was revealed. This substance is also a signal that conveys information about problems with mitochondria to the cell nucleus and thus triggers the activity of genes associated with longevity. It helps maintain the ability of stem cells to repair tissue. Alpha-ketoglutarate reduces the production of hydrogen peroxide in cells, thereby acting as an antioxidant. The loss of collagen, the most important protein in connective tissue, is one of the markers of aging. Alpha-ketoglutarate, along with the amino acid proline, is a factor necessary for collagen synthesis. It also stimulates protein biosynthesis in muscles and bones, as several types of amino acids are formed from it at once. It is actively used in sports nutrition. There is evidence of its beneficial effect on immunity, as well as in cataracts, liver and kidney diseases. Since it is a biochemical precursor of glutamate, at high concentrations it can cause excitotoxicity, overexcitation and death of neurons. Experiments have shown that adding alpha-ketoglutarate to the culture medium of nematode worms increased their lifespan. It is found in foods that contain large amounts of organic acids, such as citrus juice. Alpha-ketoglutarate protects tissue from damage associated with excessive levels of nitrogenous compounds, primarily ammonia, such as excessive protein intake. This protection is especially important for the brain tissue. The study suggests the potential usefulness of alpha-ketoglutarate in osteopenic postmenopausal women. AKG-CA induced beneficial changes in serum CTX, which was consistent with preserving the bone mass in the lumbar spine. Alpha-KG suppresses ATP synthase, and alterations of the energy metabolism trigger the nutritional sensors to down-regulate mTOR pathway. These events not only benefit the general aging process but also maintain ovarian function and delay the reproductive decline.